tonight. My take will also be on that, and it's focusing a little bit on some of your feedback. You don't want to miss that. But before that, our discussion tonight is with the CEO of Inuka Trust, John Githongo. You've known him for a long time in this country. People still refer to him as the anti-corruption czar. We'll be hearing his insights on matters corruption in this country, whether the war on corruption, and just what will it take to solve this issue once and for all. John Githongo will be my guest on Checkpoint in just a short while. Keep your comments coming in. The hashtag is Checkpoint. You can use 47 days of accountability if you like on Twitter. You can also send us a text message 22155. That is coming up. Please do stay with us for that discussion on corruption with John Githongo in just a short while. All right, now we want to bring you the top story tonight, and it's about the crisis in the public health sector after the government failed to avert a planned strike by doctors and nurses despite a high-level meeting that took place at Afya House a little earlier on today. Now, we understand a press conference has been called about this health workers' strike. We are waiting on word on that. The Cabinet Secretary for Health, the Cabinet Secretary for Finance, and Sarah Serem from the Salaries and Remunerations Commission will be addressing journalists in just a short while. We will bring you that press conference live, should it happen, during the course of this live newscast here on Checkpoint. We're waiting on that. But in the meantime, please take a look at this story we prepared for you here on this issue.
On the 5th of December 2016, kindly make necessary arrangements, kindly ensure that emergency services are attended to in private hospitals that are next to you.
Keen to avert a crisis in the health sector, Health Cabinet Secretary Cleopas Mailu, Principal Secretary Nicholas Muraguri, Treasury CS Henry Rotich, PS Kamau Duge, and Chief of Staff and Head of Public Service Joseph Kenywa spent the better part of Sunday afternoon at Afya House in talks over the impending doctors' strike. Just as to the lapse of the 21-day strike notice given by the Kenya Medical Practitioners, Pharmacists and Dentists Union. Union officials claim they did not get any formal invitation to the meeting. The doctors want the government to honor a June 2013 collective bargaining agreement signed between the Ministry of Health and the Doctors Union.
We want doctors to be paid as per the agreement that we signed in 2013. And this collective bargaining agreement also talks about staffing issues, talks about internship issues, which have been a very big problem at the county level.
The Employment and Labor Relations Court on Friday suspended the doctors' strike for 30 days to allow for negotiations on issues arising from the CBA. And the effect of the doctors' strike may be heavily felt at the coast. The Mombasa County Government's Health Department, in a notice to chief officers in Kwale, Kilifi, Lamu, Taita Taveta and Tana River counties, says there should be no referrals from the 5 counties to the Coast General Hospital. Nurses too are set to go on strike beginning Monday. The nurses want harmonization of salaries and pay grades. Unlike the doctors whose CBA has been signed, how to address the nurses' concerns is still being discussed. On Friday, following an application by the Council of Governors, the Employment and Labor Relations Court stopped the nurses' strike pending the hearing of the application on the 13th of this month. But the nurses will hear none of that.
Hakuna kazi itaendelea katika zahanati zote. Ni zahanati ama inaitwa namna gani? Katika zahanati zote za umma humu nchini kuanzia saa 5 na dakika 50 na